All right, everybody, thanks for tuning in. Myself, Dr. Nykiel, out of Southern California. I'm here with the great Dr. Johnny Franco out of Austin, Texas. Everything's bigger in Texas.
Exactly. I'm pleasure to be with SoCal Plastic Surgeon, one of the greatest Instagrams that I follow.
And not to actually be outdone by Austin Plastic Surgeon. I mean, check out his stuff, too.
Appreciate it. So I think today we're talking about a little coast-to-coast plastic surgery here?
We are. We're talking about from the Texan coast to the SoCal coast. Is that right? Actually, shot from Manhattan. So this is a true transcontinental deal right here.
And which is fitting because we're talking about total body transformation.
We are talking about total body transformation. So one of the things I think that is being asked of us more and more, Dr. Franco, your practice is butt augmentation, body contouring. I kind of call it hourglass contouring. Is that sort of a fair way to do it? I also kind of have similar practice.
Yeah.
So one of the things we ask the most is, can you do breast procedures with butt procedures?
Yeah, I do, but to a limited fashion. So
Okay.
I'll do a breast augmentation and a BBL at the same time.
Okay.
I won't do a full mastopexy, breast reduction, and a BBL at the same time.
Okay.
Just because I feel like you compromise some of the results in one or the other.
Totally. So give it to me real quick, like everyone's a candidate for breast augmentation BBL, or is that you're pretty...
I would say most people can qualify for that because typically if you have more issues going on with the breast, then you're not going to be a straightforward breast augmentation candidate.
I agree. I agree.
That's typically my line.
Okay, I gotcha. So let's throw out another scenario at you here. What makes you decide to combo breast and butt? Are there any benefits from it? Is it totally just patients brought in, or is it give me positives and negatives?
Yeah, most of the time it's patients they're going to take 2 weeks off for their BBL recovery typically, and so they're like, I want to do my breast aug. It's going to be hard to take more time off, and so they know the recovery is going to be a little bit more, but they're like, I got this time off. I've worked out. Grandmother coming to take care of the kids. I've worked out time off. I've sent the family away, so they've got their plan. Those are window
Don't mess with grandma. Yeah.
Can't mess with grandma.
Don't mess with grandma.
What about you in your practice? What do you do?
Yeah, so
we don't always agree on everything.
We don't agree on everything. My way's always right, I like to tell them. So listen, I think butt and breast combo procedure is super powerful, especially when we talk about from an hourglass perspective. I think, what are we doing? I think in the long run, we're balancing hip, shoulder to chest, right? So I think certainly in some of those cases, when we add in the breast augmentation portion, that gives you that total hourglass contouring. So I think as far as I really believe this. As far as procedures go, I think that's one of the most powerful body contouring, body makeover, hourglass makeover procedures.
But do you do breast lift and BBL at the same time?
I do.
You're dancing around my
I do.
here.
I will do. I will do a breast lift. But I want to change that. That is not a breast reduction, right? Okay. Like we're talking. A breast lift is basically what I define as like, someone's had kids, they still have volume, they just got a little bit of sag after. Breastfeeding. Cool. We'll do a lift at the same time. Someone comes in, big, massive breasts. That procedure in itself is going to take a couple hours. That's not the type of person I'm going to combine with a butt augmentation, and that just rolls back to safety.
So you will, but again, very selective in who you will do it.
Yeah. But I think implants, breast implants, and butt augmentation, great combination. I think it's a phenomenal combination. Now, on that, let me switch up a little bit. I know you and I have chatted about this a little bit more. Run me through tummy tuck butt augmentation.
That's a great question because that's like our mommy makeover that's really been switched over a little bit because I think a couple things we see it all the time where people have gotten a tummy tuck, their belly looks great, but for whatever reason the love handles weren't addressed, the upper back weren't addressed, the midsection.
So let me interrupt you here for a second because I want to challenge you on something. I'd say that a tummy tuck does not address the waist and love handles for the most part, right?
Correct. I mean, a lot of people get a tummy tuck and think that their waist is going to be tiny, or a term I hear from my Instagram patients is snatched.
Yeah.
And it does in terms of cinch like an internal corset of the muscle plication, but it doesn't address the excess fatty tissue in our love handles that unfortunately I and a lot of my patients have.
Yeah. So how do you address waist? So if I came to you wanting a snatched waist, Dr. Franco.
Yeah.
What's my answer?
Yeah, I mean, I think you can't do that without doing Lipo 360 if you don't get all the way around them. And then you got to decide what to do with the belly. If they need a tummy tuck, if you have loose skin below the panty line, that type of stuff, or belt line for our men, then you need to address that. Tightening the muscles if it's been stretched out due to weight or pregnancy. So I think that's why it's important to go to someone that knows and has all the option stuff. Because if somebody only does one procedure, that's what you're going to get offered.
Yep, I totally agree with that. So a couple quick plugs I want to make here because I think you do a really nice job at it. Check out your Instagram, Awesome Plastic Surgeon. You do a great job of showing before and afters. You bring in real patient selfie before and afters and real patient belfies. I think that is excellent and great work, very informative. Good use.
I appreciate that, and to that point, one of the biggest things on Instagram, Snapchat, this stuff is there's a lot of fake photos. We joke about fake news, but there's fake news in Instagram and before and after picture stuff. And on your Instagram, SoCal Plastic Surgeon, you do a great job of showing what's a real photo, what's photoshopped, and so forth. Because I think the biggest thing is having realistic expectations. And you guys do a great job of pointing out, look, this is not possible for your waist to be this tiny and your butt this big when you weigh 90 pounds. That's not natural. And so
to look like Barbie is not possible. She has unrealistic measurements, right? I think that's part of the challenge. And we spend a lot of time, thanks for pointing out, to do real versus fake. I was actually just told by the kids that means that my Instagram is woke.
Does that make us hip?
That
you're woke?
I'm not. God knows I'm not hip, but I am woke, kids. I'm woke. So let's see. Let's wrap it up here. What else you got for me? Anything else?
That's it.
That's it?
That's it. I would say, make sure you follow, a board-certified plastic surgeon. There's a lot of great info on Instagram, Snapchat, but also separate the real from the not. There was a recent study that 70% of the aesthetic surgeries on Instagram, on Snapchat are for non-plastic surgeons. So make sure there's a lot of great information out there, but filter it. Be selective of who you're getting information from.
Let me just, as we're wrapping this up, I think, and this is the last great point, what's it matter? 70% of stuff's on Instagram. It's not real plastic surgeons. What's it matter?
Yeah,
why do people care?
No, I think it matters for a couple reasons. One, you want to make sure that what you're going into is actually what you're getting. Nobody wants to buy a lemon, especially when the lemon is you.
Yep. So step one is give them what you paid for, right?
Get what you paid for, because when you come to somebody that does this, they're going to be real with you and say, hey, I can't do that. I can't give you those results. And then you can decide, hey, I'm still going to be happy with what they tell me they can do. Second, everybody's going to have problems if you've had surgery. There's a risk for it. But you want to be with somebody that's going to be able to take care of it. If Dr. Nykiel or I ever had an issue, we will treat you afterwards. We're not going anywhere. You will find us.
Accountability. Step 2, accountability, right? So we got step 1, get what you pay for. Step 2 is accountability. May I throw out step 3?
Sure.
Safety, right? I think that's the biggest portion. We as board-certified plastic surgeons, we as plastic surgeons, we are held to a certain set of standards that we guarantee we will have certain safety checks in place. Those safety checks do not exist. And one of the ways I tell people, and I'd love to hear your opinion on this, is, you know what, if I go buy a BMW and someone's selling me a BMW for 10 grand, something's wrong with that BMW, right? Either that car is 30 years old and the safety, the airbags aren't working, or there aren't airbags. I think that's an important thing. You can only cut a cost down so much before the safety aspect of it and the customer centric aspect of it is removed. And that's just dangerous.
No question. And I think this is why we talk about patient care all the time, because we worry about it. And I think anyone who doesn't worry about it hasn't done enough plastic surgery.
I totally agree with you. So board-certified plastic surgeons, real plastic surgeons on Instagram, get what you paid for, be safe, and
get what you pay for.